Okay, all right, well, good morning, folks. We're here for another update for the COVID-19 pandemic across the Murrumbidgee region. So let's just start off with the data, and obviously for our people and community, good news continues. We've still got the same number of cases now that we've had for the last 6 weeks, so that's brilliant news. But 45 people in our region have contracted COVID-19, and we have to remind ourselves that sadly one person has lost their life in our region during the pandemic. Another message is about the fact that there were 6 new cases in New South Wales yesterday, so we're not out of the woods yet. But the good news is that the people across our region have been amazing about helping us keep these low infection rates at the level that they are. What are they doing? They're coming out and being tested. I'm so proud that in the Murrumbidgee region, our test rates are actually going up each week, and we've now hit over 10,000. 123 people have actually come forward to be tested, more and more each week. And the news for people is that just because you're tested 1 week for negative COVID-19, if you get crook again next month, the bad news is you actually have to come forward and be tested again, because testing is not a sign of immunity, it's just a sign that you don't have COVID-19 at that point in time. And it is winter time, so we're going to get sick on and off during this period. So I really would encourage people, if you've had the test once and you're sick again a bit later on in the winter, please don't hesitate to come forward again. Good news around the 1st of June, we're seeing some easing and relaxing of the restrictions. And for many people, it's an opportunity to get out of home isolation for the first time, travel around the region in a cautious way. But I want to remind people that it's not a time to relax and forget about the 2 messages that you hear every day in your lives, which is we have to continue with our physical distancing and our social distancing, and also washing your hands. Look, our businesses across the Murrumbidgee region are a really good reminder when we come out of the house that something's not right. And I'm so proud of businesses across our region. Their COVID safety work plans are spot on. You just go into any shop and you'll get the physical distancing, the 4-metre rule where you have to stand in a queue. There's hand washing, sanitation stations everywhere. And also, of course, some of our pubs and clubs are also having to do record keeping now of people who are coming into their restaurants or their eating areas. So thank you to the businesses, we really appreciate that. And it's role modelling the behaviour that we need to do when we're not in a business, that we need to do at home. So physical distancing is what's going to keep us healthy right now. To help people get more access to testing, we're finding more and more ways of getting our testing people out and about, especially in a rural area. Our mobile testing van has just absolutely hit the spot. It's been really super successful. We've got very high numbers because we're actually taking testing to people even in small towns. For example, it's in Girildery today, Collyamberley, a really great spot. It's going to Ungary and Berrigan tomorrow, and then across to Yenda, Hanwood and Griffith over the next few days. So that mobile testing van is really exciting. And also you'll see some roadside testing across our region as well. GPs are playing a really critical role. They're really helping our numbers to come up, and we've got some new GPs in Griffith, Gundagai, Tumut and Deniliquin who've come online with testing as well. So it gives people a range of options about where they feel safe to go. One of the things that I've been really focused on is helping people who get tested, and the 2 things we can help them with is to get their results sooner. Because when you have a test, we do ask you to go into isolation. We want you to stay at home because you've got symptoms. So what we would like to do is to limit that amount of time you have to stay at home. So gone was the 2 weeks, gone was the week. We're now down to 30 hours on average, and some people are getting their results back in 24, 48 hours. If you have your testing done in a public clinic, we'll also give you results by text message. For frontline workers, such as our police, teachers and health workers, they get prioritised for testing. We'll get their results back within 24 hours so we can get those people back on the front line as soon as we possibly can. So 2 other messages today. One is about people and the larger health impact of being this protracted time in isolation and the government restrictions. So we've seen some people use home isolation as a real catalyst to do a whole range of things about reaching out to other people, music and baking and a whole lot of things. But there are some people who are not travelling so well, guys, and they're the people that I really want to ensure that the health system can care for and provide additional support. So our mental health workers and also our counsellors and also the primary health network counsellors are really looking at different ways of connecting with people, particularly over social media or over telehealth, so that we can reach out and really support people in a different kind of way. And there's been a good uptake. People are finding that's helpful even over the phone. Also, what we're focusing on is if people have had an episode of wellness with us, that we are really assertively following them up. Their mental health's important, and once they actually leave our care or they go back home, we're making sure that we follow them up really, really strongly. And then finally, please, everybody must remember there is help out there if you need it. Lifeline and Beyond Blue have got really fantastic support for people who are generally anxious, just feeling uncertain about what's going on right now, and people who are really lonely or isolated at home. And the last bit of news this morning is about surgery. So during this pandemic, when we had to increase the capability of our hospitals to provide intensive care, we had to defer some of the non-emergency and non-urgent elective surgery. So that's things like cataract, eye operations and joint replacements. And those people had their surgery deferred. So the good news is that we're working with the surgeons now to restore the surgery by up to 75% of surgery will be restored and underway. And this work will start from the 30th of June. So even as soon as next week, we're starting to ramp up again, more and more lists every week. We want to reassure you though that we will maintain the capability within the hospital as well as doing the surgery. We will maintain the extended intensive care capability, the availability of those extra staff that we have trained, all those nurses and physios, and also the extra equipment that we've got available for people. We've got good supplies of PPE now coming through, thanks to some really great work across the state, and we're seeing much larger stockpiles of PPE that's available and is sent out to local health districts on a weekly basis to make sure that we have that availability right and that we're using it appropriately. So guys, we need to hang in there. We're all in this and we're going to come out really well the other side. So thank you all for the support from the community. Thank you, and I'll hand over now to Superintendent Bob Noble for his update. Thank you.
Thanks. Thanks, Jill. There's lots of good news in there, and obviously some further good news this week with the government relaxing some of the protocols around pubs, clubs, restaurants, eateries, and social distancing and movement more generally. There are still some things in place that haven't changed. The no more than 10-person gathering in a public place, unless they're all members of the same household. Only 5 members to visit another household as well, so some of these things haven't changed. I think most of us would agree that the opening up of pubs, clubs and restaurants for dining is a good thing, and for socialising generally, because it allows us to socialise and get together and support one another in a more traditional and satisfactory way for most of us. And we probably all welcome that. And it's also good for some of these businesses to be able to generate some income and get some income circulating around the community. But I would caution, it's not a green light, it's probably more like an amber light. We should proceed with caution to that end. It is not a free-for-all, and clubs, restaurants, your favourite cafes and pubs, they've got some fairly stringent controls around what they can and can't do and what they must do. They can't have more people in the place that goes beyond the 4 square metres per person, and they can't have more than 50 people per seated dining area. So that's fairly stringent. They've got to put some controls around that. They've also got to record the names and details of people coming in for the sake of contact tracing if there's a confirmed case that comes through. So please be patient with your favourite cafe or restaurant or pub or club. The police will be working with these various enterprises along with the regulatory bodies to try and make it as easy as possible for them to get opened, generate some income, some wages for their staff, and provide a valuable amenity for the community. But we're going to have to work at it together. The police certainly will be enforcing the protocols as they exist now, but we're going to try and do it with a focus on compliance and on safety and on health, rather than enforcement for enforcement's sake. So to that end, we will, of course, exercise discretion wherever it's appropriate to do so. We also have the long weekend coming up this weekend, and that's going to promote probably extra movement of people generally. So it's an interesting time. The government and the health ministry has pulled one or two levers here, as they already have, and we'll have to sit back and look at what effect that has. And I think people have to have reasonable expectations that, if we get some bad results, perhaps the next phase, might be something they need to think very carefully. But this is very positive, and I think we'll all embrace it. But it's a matter of all being responsible, doing the right thing, and as Jill said, the social distancing and the hygiene are two things we need to observe, and the 1.5 metre distance between persons is still something that is recommended best practice and we should be doing. So that's really all I've got, and I believe there's some general law enforcement questions that we might speak about later, but was there any questions specifically about this, or can I hand back to Jill?
Yes, I've got a question. What will police be doing, i.e. resources, regarding these new restriction orders given out by the state governments? What has your command done to ensure that you'll be able to get around and enforce, or not enforce, but check out they're doing the right thing?
Well, we'll be enforcing, the regulations and the directions as they are. We've been fortunate, as most agencies across the spectrum of government, that our staffing hasn't been too badly affected at this stage due to sickness or people having to isolate. So we've got more than sufficient resources to do that. We're also very busy with general policing and public safety work as well. But we will have extra staff rostered at this time, particularly at the long weekend, as we always do, and we'll prioritise our tasks accordingly. I mean, policing, whilst it's difficult at times, it's generally a fairly simple process in that it's about public safety, and we'll focus our resources where they're most needed, and sometimes it's alcohol-related crime, sometimes it's property crime, it might be traffic. We change our priorities on a regular basis, and if it emerges that there's an issue with a number of premises or a premise in particular that might not be doing the responsible thing, and we've seen that particularly in the metropolitan area where fines have had to be issued, we will focus firstly investigative resources towards a business and put some investigation in it. If we have to, we'll fine people, but we want to work with these businesses and enterprises to ensure that they, it's easy for them to comply and everyone can get what they need. I mean, that's what our focus is.
Are the $1,000 fines still something you'll be handing out?
Yeah, as is appropriate. We haven't handed too many fines out the last few weeks, which is really good. And I think that shows that people are in good faith accepting the relaxations as they've been meted out. And I suspect we'll see more of that. We have a tolerant society, we have a patient society, but it's a matter of being sensible about it. We don't want to be too stringent with our enforcement, but we're not going to be lax either if we think public safety and hygiene and health is going to be compromised. So, all right.
Just one further question, just on that. So has there been, it's around the licensing police, is that what your licensing police would usually go around the pubs and clubs? Does that mean you've expanded that particular area?
Well, our licensing branch, still continues to work as it would, and they're providing a lot of specialist advice to our general duties and uniform police generally. We've had very little action in and around licensed premises the last 2 months, so we've been able to put our police into other things. There's been a ton of proactivity delivered around property crime, a lot of great arrests around the Riverina and in Wagga itself for car thieves, armed robbers and so forth, and people committing break and enters. So we've had some really good results, but yes, as licensed premises open back up and some of the rules need to be adapted to, not just by the operators but by the public, we will have a greater focus on licensing, and I think that will continue to build as we move forward through relaxations being increased. All right, so were there questions for Jill? I reckon there might be. No?
Yeah, I have got some questions for you, Jill.
Right, thank you very much.
You did touch on some of these, but just further, there's still an active case in Kuta and Gundy, is that correct?
There's a case that hasn't recovered yet in that region, so we've got 43 recovered people in our area. Some people take some considerable weeks to actually be symptom-free after having COVID-19. So that person is not contagious and is free to move around the community. They've got some residual symptoms, but there is that one case that's not fully recovered, yes.
That one seems like it's a bit stubborn. It's been around for a while. Is there any particular reason for that?
Well, our public health unit follow up with people on a regular basis. So that person may well have recovered now, but is just awaiting that final phone call and check to be taken off the system. Yeah.
We've been talking about the second wave for some time now. Does Murrumbidgee expect that things might ramp up as a result of that second wave coming? Is there systems being put in place to look at that, even though we haven't got any active cases?
What we're really focusing on now is how to respond very, very quickly and assertively to a hotspot outbreak. So we've talked in the past about possibilities of outbreaks happening in a certain part of a community, and our ability to go in there, whether it's a vulnerable part of the population, whether it's an abattoir as we've seen in other states, aged care facility. So the idea is that we get knowledge of that early because we've been doing high rates of testing, but we've been really focusing on doing scenarios so that we can have a very rapid response and an emergency plan to resource that and really contact trace people very, very quickly. And our staff have now been trained in usage of the COVID safety app, so that will also assist for people who can't remember who they've been around, for us to be able to do that additional work. So we call that really outbreak emergency plans, and the idea is that we contain that infection to a very small area to prevent it becoming a wave broadly across our region. So that's what we're really focusing on, and we're doing more and more scenarios as we go through the weeks and getting far more skilled at that really rapid response.
Is it hard, just one final thing, is it hard to keep the staff on their toes, if you like, given that we've been pretty lucky in this area? Is it hard to sort of get them out, be ready people, this could happen at any minute? Is that difficult from a management perspective?
One of the things that our clinicians in the hospitals are facing is every person who comes in to receive healthcare, whether it's in the community actually, the ED or the hospital, if they have any kind of respiratory symptoms, we still have to treat them as a possible COVID patient. And for staff and for the family and patients, that means the whole full PPE with the goggles and the gowns and the masks. So it's still very alive in the minds of our clinicians because of that use of PPE. And we've really been fortunate in Wagga that we've been able to do local testing. So for patients who are in our hospitals, our Wagga laboratory here can turn around their test results really quickly. And that is great for patients because they find out quickly if they have or haven't got COVID. But it also means that we minimise the use of PPE, which is great for everybody. So it is on the minds of our clinicians, and they still are in the mindset of anybody with symptoms could have COVID-19, and our responsibility is to keep them safe. Yeah.
Thanks, Jill.
Okay.
Good stuff. Is there some general law enforcement stuff?